You may have seen this week's news about a new heart transplant done here in the UK, but what's so new about it? Some reports have called it a dead heart, but that's not quite true. It was a joint project between Great Ormond Street's Children's Hospital in London and Royal Papworth Hospital in Cambridge, where I used to work. In fact, I was lucky enough to be a member of the transplant team when we did the first of this type of heart transplant in an adult. Up until then, heart transplants were taken from people who'd suffered brain death, normally from a head injury or a stroke, which isn't that common. The heart is still beating, but the brain is dead. This is called donation after brain death, or DBD. DCD, or donation after circulatory death, is the new technique where the heart is actually stopped before it is retrieved and has to be restarted and kept on this special device sometimes called a heart in a box. This means loads more people can be considered as potential donors, and already 6 British children have had their lives saved with this. The DCD program has increased the number of heart transplants, but donors are still in short supply, so whatever your age, please consider registering as an organ donor.